This is used for a patient who cannot brush their teeth. Like a patient is NPO, nothing by mouth, or your patient is having a contractures, a patient who is unconscious, because unconscious patient don't talk, right? They're like in deep sleep. Patient really cannot clean their mouth due to certain diseases. You're going to get a lot of these and put the water, maybe half, like little water and the same amount of your mouthwash for them to get maybe 6 of these or 8 or 10. This is America. Okay, so put on in here, you stir in here, but when you put this one in the mouth of the patient, make it sure that it's really, you squeeze. You're not going to put any water. It's just to soak them. Okay, so start from the top. Okay, you start from the top, like up and down, right? Okay, if it's filthy, throw it away. Get the other one again, you squeeze. Okay, this is for unconscious patient, because even the patient don't talk. If they have a stroke, they cannot talk, right? They're like, yeah. Their mouth, after 15 minutes, bacteria sets in. You're gonna have a bad smell. Even you have your mask. There is just imagine yourself, if you don't drink, right? How much more this patient? They have a lot of accumulation later on. They're going to have yeast in their mouth. White tongue, white gum, white, yeah? Don't wait for those. Okay? Patient is already in pain.
You can use mouthwash.
Huh?
Mouthwash.
Yeah, that's what I said.
Do we add a
But
little
water,
toothpaste?
maybe same amount water and same amount of your mouthwash.
Do we add a little toothpaste to that as well or no?
No.
Okay.
We're not going to use toothbrush and toothpaste. Just that. Just the mouthwash and water mixed with water. Okay, let's do. I wash my hands before I enter the room. Knock, knock, may I come in? Good morning, my name is Anna. I'm your CNA for today. May I check your ID badge? Your name is Grace Lee. Mrs. Lee, I'm here to help you to provide oral care or mouth care. Okay? I'm going to get my supplies. I will be right back. Here is your collar. Okay. The box. Do you have the box there?
No box here?
Okay, make sure you're gonna hold this one. Alright, Mrs. Lee, I'm back with my supplies. No. Thank you. Okay. Close your curtain for your privacy. Lock your bed for safety. Raise your bed to make home. Alright. Can I have your collar? Alright, Mrs. Lee. Okay, I'm going to put my gloves on. Now I'm going to sit you up 75 to 90 degrees. So the bed is not functioning. So you're going to have to get about 3. I'm going to sit you up. 1, 2, 3. Make yourself comfortable. Okay. Alright. So here. I'm going to put this across your chest. Okay. Then put the small in front of the patient. their legs is, up, you're going to move this one a little bit. Okay? Alright? Here. The position of this kidney basin, they call kidney because it forms like kidney. Or emesis basin, like emesis, like, you're right? So this one is going underneath the cheek. That makes sense? Alright. So, wet toothpaste. Do not attempt to open this. Do not attempt to put in toothpaste. Okay? Pretending. Toothpaste. Alright, now Mrs. Lee, I'm going to help you brush your teeth. Beginning top. Okay? Up and down, up and down. Same with the other side. Okay? And back and forth, and then the bottom, up and down, back and forth, and all the surfaces. That's very important. Okay? And do not do like this. That is back and forth inside. Okay, the inside. But for here, you to brush your teeth like up and down, right? To get rid the right. So now, and all the surfaces. So put your hand here. Okay, if they are or here. Okay, because the pen is supposed to be here. Okay, so now, and can you stick out your? Can you stick out? Stick out your tongue, then I'm going to clean it. Alright? Okay, Mrs. Lee, I want you to rinse your mouth and spit here. Okay, good. Alright. Okay, Mrs. Lee, we are done for today. Do not grab here. You're going to fold this way. Okay? Alright, Mrs. Lee, we're almost done. I'm going to clean up my supplies and I will be right back. Do you want to lay down or you stay like this? Oh, lay down. Okay, you can stay. Now you're going to the bathroom.
It's more comfortable now.
Going to the bathroom, right? So, where are we gonna put this? Soiled bean. Soiled meaning dirty bean. Okay? You clean, right? You wash this one, you hold it, and you're going to empty in the sink, right? Clean and empty, dry, and put in the designated area. Okay? Down or empty, water, clean, rinse, dry, designated area. Okay? You got it? Yeah. Even you are doing here, that's your designated area. Okay? Then put in the salt bin. Remove my gloves. Okay? Pour in the middle. Put in the trash. Wash my hands. Alright, Mrs. Lee. I'm back. We are done for today. Put your legs in the lowest position. You have your collars. And I'll see you later.
Open your
Wash your hands. Documents.
Alright.